Military veterans are a population particularly vulnerable to developing post-traumatic stress disorder, PTSD, due to their exposure to combat and other traumatic experiences. The unique nature of military service presents specific challenges for veterans in coping with and treating PTSD. This video explores the coping mechanisms and treatments for PTSD in military veterans and discusses the unique challenges faced by this population. Challenges faced by military veterans. Exposure to combat. Military veterans are frequently exposed to life-threatening situations, including combat, explosions, and witnessing the death or injury of comrades. These intense experiences can lead to the development of PTSD, characterized by symptoms such as flashbacks, nightmares, and hypervigilance. The constant threat to life and repeated exposure to traumatic events can create a heightened state of alertness and anxiety. Transition to civilian life. Transitioning from military to civilian life can be challenging for veterans. The change in environment, loss of camaraderie, and difficulty finding meaningful employment can exacerbate PTSD symptoms and lead to feelings of isolation and disconnection. Veterans may struggle to adapt to civilian norms and expectations, and the lack of a structured and supportive environment can impact their mental health. Stigma and barriers to seeking help. There is often a stigma associated with mental health issues within the military culture. Veterans may fear that seeking help for PTSD will be perceived as a sign of weakness or affect their career prospects. This stigma can prevent individuals from accessing the care they need. Additionally, logistical barriers such as long wait times for services and limited access to specialized care can hinder treatment. Coping mechanisms for PTSD in military veterans. Peer support. Peer support programs can be incredibly beneficial for veterans with PTSD. Connecting with others who have shared similar experiences provides a sense of understanding and camaraderie. Peer support groups and veteran organizations offer a safe space for veterans to share their stories and receive emotional support. Peer mentors who have successfully managed their PTSD can provide guidance and encouragement. Physical activity. Physical activity is a valuable coping mechanism for managing PTSD symptoms. Exercise releases endorphins, which are natural mood elevators, and helps reduce stress and anxiety. Activities such as running, weightlifting, and yoga can provide both physical and mental health benefits. Engaging in team sports or group fitness classes can also foster a sense of community and support. Mindfulness and meditation. Mindfulness practices and meditation can help veterans manage PTSD symptoms by promoting relaxation and emotional regulation. Techniques such as deep breathing, guided imagery, and progressive muscle relaxation can reduce stress and improve overall well-being. Mindfulness-based stress reduction, MBSR programs tailored for veterans have shown promising results in reducing PTSD symptoms and enhancing quality of life. Effective treatments for PTSD in military veterans. Hypnotherapy. Hypnotherapy is the most effective therapy to heal trauma. Cognitive behavioral therapy, CBT. Cognitive behavioral therapy, CBT, is an evidence-based treatment for PTSD that helps individuals identify and challenge negative thought patterns and behaviors. CBT has been shown to be effective in reducing PTSD symptoms and improving coping strategies for veterans. Techniques such as cognitive restructuring and exposure therapy are commonly used in CBT to address trauma-related thoughts and behaviors. Prolonged exposure therapy, PE. Prolonged exposure therapy, PE, involves gradually exposing individuals to trauma-related memories and situations in a controlled and safe environment. This process helps desensitize veterans to traumatic memories and reduce avoidance behaviors. PE has been found to be particularly effective for combat-related PTSD. The therapy involves repeated recounting of traumatic experiences and real-world exposure to avoided situations. Eye movement desensitization and reprocessing, EMDR. EMDR is a structured therapy that involves guided eye movements while recalling traumatic memories. This process helps reprocess traumatic memories and reduce their emotional intensity. EMDR has been shown to be effective in treating PTSD in veterans, helping them integrate traumatic experiences and reduce symptoms. The therapy also incorporates techniques to enhance emotional regulation and stress management. Military veterans face unique challenges in coping with and treating PTSD. Understanding these challenges and providing tailored support and treatment options are crucial for promoting their recovery. Effective coping mechanisms such as peer support, physical activity, and mindfulness, combined with evidence-based treatments like CBT, EMDR, and medication, can help veterans manage PTSD symptoms and improve their well-being. By addressing the specific needs of military veterans, we can support their journey to healing and resilience. Providing comprehensive and compassionate care is essential for honoring their service and promoting their mental health.